Hello. I'm Dr. John, and this is the channel where health and education meet. Did you know that thousands of men discover prostate cancer too late simply because they ignored signs that seemed harmless? Difficulty urinating, the constant urge to go to the bathroom at night, or even a slight pain in the lower back. These can all be warning signs that many men overlook. And the worst part? When the symptoms become evident, the disease may already be in an advanced stage. But today, I'm going to show you exactly what the early signs of prostate cancer are that every man needs to know before it's too late. If you're over 40 or know someone who is, this video could literally save lives. Here, you'll learn how to recognize symptoms early, what to do if you notice something unusual, and, most importantly, how to act to prevent a simple oversight from turning into a serious problem. We'll also talk about exams, prevention, and simple changes that can drastically reduce risks. Information could be the difference between a simple treatment and a late diagnosis, and I guarantee that after this video, you'll never look at your health the same way again. Now, answer me, have you ever experienced difficulty urinating and thought it was normal? Or maybe you've noticed changes in your body but decided to ignore them? If so, stay with me until the end because the answers you need may be in the next few minutes. Prostate cancer is one of the most common diseases among men, and the reason is quite simple. The prostate is a gland that, over time, undergoes natural changes. The big issue is that, often, these changes can develop into uncontrolled cell growth, forming tumors. It's stealthy because in its early stages, the cancer can develop without showing any signs. And it's exactly this silent characteristic that leads so many men to be diagnosed in later stages when treatment becomes more complex. It's a mistake to think this is a rare disease. Just to give you an idea, prostate cancer is the second most common type of cancer among men worldwide. Older age, genetic predisposition, and hormonal factors are among the main triggers for the disease's development. But the good news is that, unlike many other types of cancer, this one has high treatment success rates if detected early. And this is where knowledge becomes crucial. The sooner a man understands the risks and the need for prevention, the higher the chances of avoiding complications. Now, think about this. If this is such a common problem, why do so many men still ignore the signs? The stigma against exams, the fear of diagnosis, and the false belief that it will never happen to me are barriers that prevent many from seeking help in time. The lack of information and sometimes even pride can cost a lot. But what leads men to underestimate such a serious issue? The truth is that many men grow up hearing that they need to be strong, unshakable, and that going to the doctor is for sick people. This outdated mindset makes many ignore symptoms that, deep down, have been bothering them for a while. Additionally, there is the fear of undergoing preventive exams, like the digital rectal exam, purely due to prejudice and misinformation. The problem is that this resistance can turn a simple diagnosis into a much harder battle when the disease has already progressed. Another contributing factor to negligence is the absence of pain in the early stages of prostate cancer. If it doesn't hurt, many think everything is fine. But the body gives signs, even if subtle, and ignoring them can be very costly. Small changes in routine, like needing to go to the bathroom more often or experiencing difficulty urinating, are often attributed to aging or stress. But are these symptoms really that harmless? The lack of knowledge means many only seek help once the problem is already established, and let's not forget the fear of diagnosis. Many avoid the doctor because they are terrified of hearing bad news. But avoiding reality doesn't change the facts. On the contrary, it only decreases the chances of effective treatment. What few realize is that an early diagnosis can mean a quick solution with no major complications. So, what are these first signs that no one can ignore? prostate cancer can be silent in the beginning, but the body always gives clues that something is wrong. One of the first signs many men ignore is difficulty urinating. It can start subtly, like a weaker stream or that feeling that the bladder never empties completely. If you have to strain to urinate or notice that the frequency has increased, especially at night, it's a red flag. These symptoms can be confused with common aging issues, but they need to be investigated. Another symptom that deserves attention is the presence of blood in the urine or semen. This is a clear sign that something isn't right and should be taken seriously. Additionally, pain or discomfort in the pelvic or lower back area can also indicate an unhealthy prostate. Often, these symptoms are overlooked or attributed to other causes, like physical strain or age, but they could be signs that something more serious is happening. And be aware of one of the lesser-known signs: erectile dysfunction without an apparent cause. If you notice that the quality of your erections has changed and this has been accompanied by other urinary symptoms, it's time to see a doctor. The prostate plays a crucial role in male sexual function, and changes in its health can directly affect this area. But these aren't the only signs that could indicate a problem. There are also less obvious symptoms that deserve attention. Many men associate prostate cancer only with urinary problems, but the symptoms can go beyond that. One example is persistent pain in the lower back, hips, or thighs. This happens because, in some cases, the tumor may press on nerves or spread to the bones, causing discomfort. It's common for this pain to be mistaken for muscle problems or arthritis, which is why it often goes unnoticed. But if the pain doesn't improve over time or appears with other signs, it's essential to seek medical evaluation. Another symptom that few associate with prostate cancer is unexpected weight and energy loss. When the body is fighting a disease, it may burn more energy than usual, leading to constant fatigue and unexplained muscle loss. Many men attribute this to stress or aging, but if you're feeling excessive fatigue without any apparent reason, it's worth investigating. This fatigue could indicate that cancer is already affecting the body more broadly. There's also a subtle but significant change: alterations in bowel habits. Although the prostate is connected to the urinary system, abnormal growth can press on the rectum, causing constipation or discomfort during bowel movements. If this happens frequently and is accompanied by other symptoms, it may be a warning that something is wrong. Since these signs are less obvious, many end up ignoring them. But what few people know is that prostate cancer can also be linked to other health problems. Prostate cancer doesn't occur in isolation in the body. It's often connected to other health issues that could be warning signs. For example, studies show that men with metabolic syndrome, characterized by abdominal obesity, high blood pressure, and elevated cholesterol, are at higher risk of developing aggressive prostate cancer. This is because chronic inflammation and high insulin levels create an environment conducive to uncontrolled cell growth. In other words, taking care of metabolic health isn't just about appearance, it's a real prevention strategy. Another important point is the connection between prostate cancer and cardiovascular health. Men who suffer from heart diseases, like atherosclerosis, tend to be more prone to developing cancer, possibly due to inflammatory and hormonal factors. This means that maintaining a balanced diet, exercising, and managing stress not only protects the heart but also reduces cancer risk. It's a connection that many are unaware of, but it makes all the difference in long-term prevention. And let's not forget testosterone. There's a huge debate about the impact of this hormone on the prostate. Some studies suggest that very low levels may be related to more aggressive cancer, while others point out that an excess of hormones can also be a risk factor. What is certain is that hormonal balance is essential for men's health. But how can you be sure your prostate is functioning well? The answer lies in early diagnosis, and that's what we'll discuss next. When it comes to prostate cancer, early diagnosis can be the difference between a simple treatment and a much harder battle. The first step is being attentive to your body's signals, but that's not enough. The PSA blood test, prostate-specific antigen, is one of the main methods to detect changes in the prostate. A high level may indicate inflammation, benign growth, or even cancer. However, the PSA alone isn't a definitive diagnosis, and it's essential to combine it with other exams. In addition to the PSA, the digital rectal exam is still one of the most effective methods for detecting abnormalities. Despite the prejudice many men still have, this exam lasts only a few seconds and can identify lumps or prostate hardness that the PSA cannot detect. Experienced doctors know that combining the blood test with the rectal exam significantly increases the accuracy of the diagnosis. If there's suspicion, imaging exams like MRI may be requested for a more detailed diagnosis. Another important tool is the biopsy, performed when there are concrete suspicions. Small samples of the prostate are taken and analyzed to confirm the presence of cancer. Fear and misinformation lead many men to avoid these tests, but the sooner a problem is identified, the greater the chances of a cure. The good news is that there are effective ways to prevent prostate cancer before it even becomes a threat. The best way to fight prostate cancer is to prevent it from happening in the first place. And the good news is that prevention is largely in everyone's hands. Diet plays a key role, including antioxidant-rich foods like tomatoes, broccoli, and green tea can help reduce the cellular damage that leads to cancer. On the other hand, excessive consumption of processed meats, fast food, and alcohol increases inflammation in the body, creating an environment conducive to disease development. Small changes in your diet can make a big difference in the long run. Sedentary lifestyle is another big villain. Studies show that men who exercise regularly have a lower risk of developing prostate cancer. Aerobic exercises like walking, running, or cycling help balance hormone levels and strengthen the immune system. Additionally, strength training, like weightlifting, helps maintain healthy muscles and bones, preventing metabolic problems that could influence cancer. You don't need to become an athlete, but moving daily is already a big step. Lastly, regular medical checkups are essential. Many men only see a doctor when they feel something is wrong, but prevention requires proactivity. Going to the doctor annually, especially after the age of 40, helps identify any changes in the prostate before they become serious problems. Medicine has advanced a lot in early disease detection, and those who take care of themselves early on not only gain more years of life but also better quality of life. But what if the diagnosis comes too late? Prostate cancer has a slow progression, but when left untreated, it can spread to other areas of the body, such as bones and lymph nodes. When diagnosed in advanced stages, treatment becomes more complex and, often, less effective. The lack of early intervention can result in a series of complications, such as chronic pain, bone fractures, and even loss of mobility. What's most difficult isn't just the physical impact, but also the emotional and psychological consequences of knowing that the disease could have been avoided with an earlier diagnosis. Additionally, treatment in more advanced stages may involve more aggressive therapies like chemotherapy and radiotherapy, which cause significant side effects like hair loss, nausea, and extreme fatigue. The patient's quality of life can be severely compromised. In contrast, when cancer is detected early, less invasive treatments like prostate removal surgery or hormone therapies can be performed, which have fewer side effects and provide faster recovery. That's why men who delay diagnosis or ignore warning signs often end up facing a much more serious and painful situation. Early detection is the key to survival, and that only happens when we truly take care of ourselves. So don't wait for the disease to manifest intensely. Prevention and early diagnosis are the best weapons against prostate cancer. We've come to the end of another journey of knowledge, and I hope that throughout this video, you've understood the importance of paying attention to your body's signals and proactively managing your health. Prostate cancer is a reality, but it's also a reality that can be avoided or treated with much greater success if diagnosed early. Don't put off tomorrow what you can do today. Your health is the most precious thing you have. Now it's time to take action. Mark your routine exams on the calendar, start taking care of your diet, and most importantly, start moving. Prevention is the path to a long and healthy life. By acting now, you're investing in your future, ensuring more quality of life and peace of mind for you and your loved ones. Don't wait, and don't wait for symptoms to appear in alarming ways. Subscribe to the channel to keep following more health tips, and turn on notifications so you don't miss any new content. And remember, taking care of yourself is the first step to taking care of everything around you. Change starts with you.